Columbus Small Animal Hospital loving our work. I'm Dr. Jim Kramer. This is Otis, a 10-year-old neutered male Basset Hound. Otis came to us because he has posterior paresis. He cannot stand or walk or use his hind legs. He has much reduced use of his tail, and he cannot empty his urinary bladder voluntarily. In addition to the intervertebral disc disease that is responsible for Otis's symptoms, this x-ray shows that he also has some chronic problems due to instability of his lumbar vertebrae. You can see bridges forming on the ventral surface of the lumbar vertebrae connecting the vertebrae together. As these are forming, they are known as spondylosis. Once the bridges are complete, it is known as ankylosis. You can see the most affected areas are between the lumbar vertebrae 4 and 5 and between the last lumbar vertebrae and the sacrum. These problems contribute to back pain and loss of function and will limit Otis's ability to make a complete recovery. Here Otis is receiving acupuncture treatment from my wife, Dr. Ann. She is one of the few certified veterinary acupuncturists in the state of Nebraska, having received her training from the Chi Institute in Florida.
Putting a needle in the influential point for bone, and you can see that Otis is not exhibiting any pain whatsoever after having inserted that needle.
And here is Otis with several acupuncture needles having been placed. And here is Otis during the second day of therapy. You can see the acupuncture needles have been placed. You can also see there's an indwelling urinary catheter that is allowing urine to escape, so the bladder does not overfill and become atonic, since Otis has no voluntary control.
This is Otis. On Friday he came in with posterior paresis. He was unable to bear any weight at all on his hind legs, and he wasn't wagging his tail much either. Today, following the weekend and yesterday and today with acupuncture and some other treatment, he is now up and walking, and we plan to send him home tomorrow. He does need to lose a little bit of weight, which we will work on, but he's a very happy boy and he's very well cared for at home. His mom will be making some ramps so that it allows him easier access to the deck, and he'll be able to get up on his favorite chair with the ramp she's also constructing.
Otis was presented to us unable to stand or walk, unable to use his tail, and unable to urinate voluntarily. After a few days of therapy, using Western methods and acupuncture, here is Otis walking around, wagging his tail, and has complete control of his urination. We have a great many of these cases, and they certainly are extremely rewarding. We're very happy to see Otis doing so well. So Otis has come back to see us today. It's been over 2 years since the problem that he had at the beginning of this video. Otis has received no additional treatment for that problem and has continued to do well all of this time. We're thrilled that Otis has made such a complete recovery and been able to sustain it for all of this time with no negative effects and no further treatment. Congratulations, Otis. It's another beautiful day.